Dr. Madan, what do you make of this charge being leveled that there is severe underreporting of cases? It's being reported widely all across the Gujarati media, and the government's denial, they're claiming that there is no underreporting, whereas in each hospital, as journalists stand there, they count the number of bodies coming in over 24 hours. The physical count is more than what the state is declaring for the entire state. That simply doesn't add up.
Yeah, hi. So we all know what's happening. We are seeing with our own eyes. We were not expecting that the condition will become so overwhelming, and the health sector was not ready. Basically, the hospitals were not ready to deal with the situation. Suddenly, the load has increased so much that we are not ready with the oxygen, with the ventilators, and even the ICU beds. So the capacity of the hospitals, it cannot match the burden of the population who is suffering from COVID right now. Now, I'm a clinician. I'm not I'm not the right person to comment on the government figures and everything. But we can see people dying in front of our eyes. I work in a private hospital. When I have a lot many deaths, every day, I can expect what would be happening in the government setups and, in the government hospitals, as you showed in your video. What happens is, whenever patients die of COVID, they have some or the other comorbidity like hypertension, diabetes, and what happens then is that rather than labeling that death as COVID, that death is labeled as a death because of the comorbidity. So that is how the figures may get altered, but everybody can see that people are dying like anything because of COVID.
No, but that is against the COVID protocols, because no matter what comorbidity you may have had, if you've had COVID at the time of your death, it's supposed to be reported, Dr. Patra, as a COVID-related death. Now, how do you respond to this charge being leveled against your state government in Gujarat? You were questioning what the Kejriwal government is doing in the centre, but the fact is, sir, that your government in Gujarat is facing charges of very seriously underreporting the number of deaths.
No, Rahul, these are charges after all, because as far as death in COVID is concerned, I believe there are charges against the Delhi government also, there are charges against Maharashtra government also about under-reporting of these cases, under-testing of these cases, but let's not have politicization of the whole issue only on allegations, because only a short while from now, the Chief Minister of Gujarat in fact faced an interview in a private channel and logically answered as to why these figures are right, and ICMR guideline was spoken about. So I firmly believe, well, yes, as a reporter, I mean, as a news channel, you should be showing what the truth is. But I believe the ICMR guidelines are being followed. Secondly, and most importantly, as far as Gujarat is concerned, as far as other states are concerned, today, in fact, the newspapers have come out with the caseload in all the states. Maharashtra leading with 39.60%, Uttar Pradesh with 8.27%, Chhattisgarh 7.76%, Karnataka 6.15%, Kerala 4.08%, and rest of the country accounts for 34.14%. So most of the load, in fact, the hotspot of the country's corona spread is mostly Maharashtra. So I firmly believe we have to contain Maharashtra, we have to contain Gujarat as well, and all those states which are contributing largely to this corona pandemic right now.